When discussing Orladeyo with my doctor, the fact that I lead a active lifestyle and the fact that it was going to be one pill each day, we decided that this was the best for me. My initial concerns was about the efficacy of it. So I definitely didn't want to take something that was going to make it worse. It is effective. There wasn't really a transition other than starting to take this new medication and it working.
The HAE medicine that Leah was on before Orladeyo was the frequency and the inconvenience of the injections. When we started with the injections, I was the de facto nurse. So after a while, Leah became like a little pincushion. With Orladeyo, that became a thing of the past.
It is not known if Orladeyo is safe and effective to treat an acute HAE attack. Therefore, Orladeyo should not be used to treat an acute HAE attack. Individual results may vary.
I've taken care of patients with hereditary angioedema for a little over 10 years now. Patients are interested in finding out about Orladeyo and whether it's appropriate to switch from their current prophylactic therapy based on whether it's efficacious and also based on the convenience of the medication. Transitioning patients to Orladeyo has been very seamless. In general, my patients have reported that they're very satisfied with Orladeyo.
There was no more injections. And what a relief, because now I don't have to do it wrong. I don't have to worry about how Leah takes a pill. She's really good at that. In fact, Orladeyo is the one med that she'll take without being prompted because she knows the positive impact. So as a caregiver, you look at your child and you kind of breathe a sigh of relief.
I have been on many preventative treatments, steroids, intravenous treatments, and other injectables. I hate needles. I do everything I can to avoid needles. Early on, when I started on the intravenous and the other injectables, I hoped and I prayed for a one-day pill, and then I found Orladeyo. I want everyone with HAE to know you are brave and you can do this.
What is Orladeyo? Berotralstat. Orladeyo is a prescription medicine used to prevent attacks of hereditary angioedema, or HAE, in adults and children 2 years of age and older. It is not known if Orladeyo is safe and effective in children under 2 years of age. It is not known if Orladeyo is safe and effective to treat an acute HAE attack. Therefore, Orladeyo should not be used to treat an acute HAE attack. Do not take more than 1 dose of Orladeyo per day because extra doses can cause heart rhythm problems. Important safety information. Before taking Orladeyo, tell your healthcare provider about all of your medical conditions, including if you have liver problems or kidney problems, are pregnant or planning to become pregnant. It is not known if Orladeyo can harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Orladeyo passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby while taking Orladeyo. Tell your healthcare provider about all of the medicines you take, including other medicines for HAE, prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking Orladeyo with certain other medicines may affect the way other medicines work, and other medicines may affect how Orladeyo works. Know the medicines you take and keep a list of them to show your healthcare provider and pharmacist when you get a new medicine. What are the possible side effects of Orladeyo? Taking more than 1 dose of Orladeyo per day may cause serious side effects, including heart rhythm problems. A heart rhythm problem called QTc interval prolongation can happen in people who take more than 1 dose of Orladeyo per day. This condition can cause an abnormal heartbeat. Do not take more than 1 dose of Orladeyo per day. The most common side effects of Orladeyo include abdominal pain, vomiting, diarrhea, back pain, and heartburn. These are not all of the possible side effects of Orladeyo. For more information, ask your healthcare provider or pharmacist. Talk to your healthcare provider for medical advice about side effects. You are encouraged to report side effects of prescription drugs to BioCryst Pharmaceuticals Incorporated at 1-833-633-2279 or to the FDA at www.fda.gov/MedWatch. or 1-800-FDA-1088. For more information, please see the full prescribing information, including the patient information.
It's